Yeah, thank you. Thanks for having me. So I'm Zhi Huang, a postdoc working with James and Tom at Stanford. And I had a fun talk. I had a fun chat with Ahmed about my previous study. I used to working on completely different topics, such as vehicle communication and automation. But later on, get I become very interested into the medical imaging and start becoming very interested in the pathology image analysis. And so today I would like to share our most recent research that has been published last month, a visual language foundation model for pathology image analysis using medical Twitter. And I would also like to share what's my current thought and the next step for us. And I think before we step into detail, I would like to share my current opinion on the pathology and the medical image analysis. For me, I feel like pathology diagnosis is the gold standard for medicine, and just because it informs all the subsequent medical decisions. And I always use this flow chart as an example to justify the importance of the pathology. Imagine a patient showing some symptoms, right? So they might get a blood test, and they might also go to the radiology department. And the radiology images may reveal some interesting pattern in the body. But if the radiologist suspect it's a cancer, if the tissue of the mass is cancer, then the patient might have a surgery. And the pathologist will examine a piece of the patient tissue to make the final diagnosis. So diagnosis is crucial for deciding what treatment comes next. And that's the reason pathology is the most important part in medicine, just because it leads to different treatment plan and first-line drug to use. But it is also the least automated field because there's only 20,000 pathologists in the US and Canada. And this field of study is relatively behind other fields such as radiology and other industrial imaging analysis. So it's very important, and it's also relatively understudied. Although pathology is medicine's ground truth, while clinicians still often need consensus for their diagnosis. For example, here's an image. Here's an example on the Twitter. A clinician was curious about whether other colleagues test the Ki-67 antibody in the breast carcinoma. She was actually surprised that the CAP, the College of American Pathologists recommendation, does not recommend performing it routinely. Following up to that point, a clinician from Germany said they always perform it and report it, right? And a clinician from Australia said it's around 15% of the time when they decided to perform Ki-67. And a clinician from Spain said he always do it, but he believed there's a large amount of pathologists may not performing it. So we have to accept the fact there's a large discordance on some of the pathology practices. In my personal experience, because I had many collaboration with Stanford pathologists, when they diagnose endometrium biopsies to determine the chronic endometritis, they always perform CD138 IHC staining. But they also believe that on East Coast, the New England area, people in pathology department do not perform the CD138 IHC. So that's the difference between different institute and different country. We have to accept the fact. And there's another very interesting background. Do clinicians make diagnosis based on subjective gut feelings? A recent very interesting survey on Twitter suggests that over 57% of the clinicians make diagnosis, including the use of the subjective gut feeling, right? So this is quite interesting to me. But it doesn't really imply that pathologists make arbitrary diagnosis, but it's really underscore the necessity of a tool or algorithms to mitigate such disparities or subjectivity, right? So what can be a useful tool to assist pathologists? For example, a pathology search engine compare your cases to another classic cases, because pathologists often compare the cases they are working on, right, to the previous example or the example on the textbook or the one they have gone over before. And that's how they learn and become better at their job. The more cases they see, the more they learn. So could we use a similar method to help pathologists to learn, or just simply assist them retrieving similar cases to perhaps enhance their diagnosis or help them learn something, right? Quickly pick up something, especially for the junior pathologists or the trainees or even medical students. And we believe the answer is yes, because the recent advances of pathology AI algorithms can help us distinguish cells or tissue types, generate diagnosis, and retrieve relevant images. Those pathology AI could be very, very useful for us to advance the pathology in both diagnostics and education. But however, I have to mention that in my opinion, the progress in computational pathology has been heavily constrained by the need for more diversified data set, including well-annotated labels in natural language. Just because this data limitation is very important when we consider there are more than 8,000 diseases, right? There are many tissue types, organ types, and many tumor types and tumor subtypes. So there are so many different types of differential diagnosis, potential disease types. And their pathologic classification is constantly evolving. And at the same time, thousands of clinicians have been sharing de-identified pathology images with well-annotated text on public forums, such as Twitter and maybe perhaps LinkedIn. So this tremendous amount of data established a really valuable asset for us to train a general purpose medical AI that could be able to assist us in learning, analyzing, and navigating digital slides. So to answer the aforementioned interesting question and discussion, of course, in this work, we created OpenPath dataset from Twitter and other public sources based on the US CAP, pathology hashtag guidelines. So the US CAP stands for United States and Canada Association of Pathology. It's the largest community for pathologists to collaborate and find their mutual interest with. And based on the recommended hashtags, we extract Twitter images from those 32 different hashtags. And we conduct our very stringent cohort inclusion and exclusion criteria to ensure the highest quality of the data set, and collecting the data all the way from 2006 to 2022, last year. It's been like 16 years of data. Our text cleaning, we conduct a very stringent image and text cleaning. For the text, we removed those text description not written in English, and remove those retweets, and remove those Twitter posts which were classified as sensitive by the Twitter. And we also collected some of the replies with most likes, because we believe those replies may convey more or less pathology knowledge associated with the post, right? And we also remove those information. We remove those description sometimes with question marks, because we believe those are typically having limited knowledge associated with the image they post. And we also conducted a additional text cleaning to ensure the quality, such as removing the emoji or some other irrelevant texts. And we also established a very simple binary classifier to classify whether this image is pathology image or not. If it's non-pathology image, for example, a clinician might post a selfie or a PowerPoint screenshot along with a hashtag, but it is really not a pathology image. So we just simply removed it by using the classifier, right? So, and finally, we established over 208,000 high-quality image and text pairs. And this is a large public pathology visual language dataset distributed among 32 different hashtags, as you can see on the figure. So the median number of words in a sentence is around 20. And from below, you can see here's an example text. And that's how it's different from the previous data set, right? Where the one image is paired with a categorical label, such as a image of dog and paired with the labeled dog. But in OpenPath, each image is paired with a sentence describing it in nature language. So with the nature language, we believe it's better to explain the detail of the image and may convey additional information behind the salient object on the image. And here is how we use the data to train our pathology AI. For the text in the Twitter post, we fed into a very standard clip text transformer and converted each sentence into a vector. The vector we use is, for example, 512 by 1 vector. For image in Twitter post, we fed it into the vision transformer and converted also into the vector with same dimension with our in-house pathology image preprocessor. So by training the clip model using contrastive loss, right? So the clip model is a very famous model proposed by OpenAI back in 2021. We actually impose a higher similarity between the paired image and text, and lower similarity between the uncorrelated image and text. So we trained the model with entire OpenPath data, including, here's an example. Those images may be, some of the images may be high power field H&E images. Some of the images may be like low power field overview or thumbnail of a immunohistochemistry images. So we really collected a diverse set of pathology image. And those texts are also with high quality. And we finally, after the training, we renamed this model called PLIP, which stands for Pathology Language Image Pre-training Model. Yeah, so feel free to ask any questions. Yeah. And maybe
Hey,
yeah.
sure. Yeah, sorry, I have a question I want to ask. So great work. When you are preparing the data set, I'm wondering, like, is the text data the only data source you can find as a pair, or you can also get image resolution, or which kind of staining? Because like from the overview of the different kind of image, I can tell there are like already more than like 5 different kind of staining that's already there. Yeah, my question is just like, besides the text, are you able to get other kind of information?
Yeah, this is a really great question. So when we script the Twitter data, right? So we actually get a lot of information, including the poster's name and where they are coming from, and including the geolocation information a lot. And most of them are irrelevant to this study, right? Unfortunately, for the images, we only the only information we could get is just the image. It is not possible to get the magnification of the image. Is that what you're wondering?
Yeah, great. Yeah, I get my answer. Is just like when people doctor making diagnosis, they are like their resolution images or the staining or other things also matter. But it's just hard to get it.
Yeah.
Also, just are you using the web crawler to collect the data from Twitter, or there's some other methods you're using?
Yeah, so it's a really great question. Before Elon Musk take over the Twitter, right? Now it's X. Twitter used to be having a very friendly educational API. So we actually get an official permission from Twitter to scrape those data. And the software package we use is based on Python. So we entirely based on Python. It's a Python-based pipeline. But seems now,
Nice.
according to current regulation by X, seems like the current pipeline is not working. Yeah, it's a really interesting question. Yeah.
All right, thank you. I really don't know that. Thank you for thank you for the information.
Yeah, no problem. Um, so okay, so we have finished the introduction of why and how of this study and how we train the model from those large image text data sets. Now let's delve into the results. So the plate model we train can
I ask a
perform.
question before that? Sorry.
Yeah.
Yeah, before you move on. So the text, you used it as part of your vector to do predictions, not for labeling, correct? Or both?
Can you repeat your questions? Text
Yeah,
first.
so the text that you use from the tweets were included as part of kind of like the predictor variables, or you use the text to label the images to get the diagnosis, or both?
I see. Yeah. So it's more like a so the text is more like an input rather than a label.
Got it. Okay.
But the contrastive learning is quite interesting. So either the text or the image can be considered as either input or the label to each other,
Yeah.
to the other one. Yeah, if you
see.
see the contrastive learning, it's basically try to vectorize the natural language or the image into a same vector space and just comparing their cosine similarity. We impose the higher cosine similarity on the diagonal and discourage the similarity of the diagonal. That's the basic training logic.
I see. Okay, thank you.
Yeah. So contrastive learning is not we propose. It's a very famous algorithm developed over these years. So it's a really good software tool. Yeah, really good algorithm.
Thank you.
Yep. So plate model can perform many downstream tasks, such as classifying new images without further training. So that's so-called zero-shot learning. It is especially useful for example, for the potential emergence of new disease types, right? For example, if you train let's take an extreme example. If you train a model from industrial images, such as classifying different animals, you can also use the trained model to classify, say, is a vehicle a car or truck? But of course, you might observe a very bad performance, but that's how the zero shot can do. It can basically classify any input if you have a given set of candidates. Yeah. So zero shot could be very also useful for rare or novel disease identification. So basically, it's quite useful, and it's also a way to evaluate the performance of the model. And essentially, how zero shot work? It's also very simple. Basically, when you have a set of candidates, such as tumor, adipose tissue, lymphocytes, epithelium, you basically reconstruct it into, if you have 4 different candidates, you can reconstruct them into 4 different sentences and compare the cosine similarity between those 4 sentences and the target image you input. And the correct label would be the one with highest cosine similarity. Yeah, that's very simple logic. So we evaluated the zero-shot ability across 4 external independent data sets, including Cathar column data set, across 9 different label candidates, and PanNuc and Digest PAT data set with either benign or malignant tissues, and weekly supervised lung cancer data sets with tumor versus normal. And we found that FLIP achieved the weighted F1 score of around 0.5 to 0.8 compared to F1 scores of 0.1 to 0.5 for previous CLIP model, suggesting up to 28-fold improvements. So we further dive into the pannuc dataset by looking into 19 different organs. In pannuc dataset, we have those different organ types, such as breast, bladder, colon, and so forth. And we found PLIP achieved a better zero-shot F1 score on over 16 out of 19 different organs, with 7 organ types achieved higher F1 scores, greater than 0.8, while the baseline CLIP performs only around 0.3 to 0.6. So zero-shot is useful when user want to simply plug and play the model in a new environment, right?
Sorry, just a question. What kind of model you refer to as the baseline model? I might miss that.
Oh, yeah. Great question. So it's a CLIP model. It's
like pre-trained CLIP model. There's no fine tuning or any other things.
Exactly. So the CLIP model was pre-trained on 400 million, if I remember correctly.
But that's like natural images. That's not pathology images.
Exactly.
Okay. Thank you. Oh, and because it's you calculate the similarity and do the text retrieval to find the best caption based on your text space, so you can do F1 score. Because it's like for the one you find it's exactly a positive, like it's exactly match, versus some other language test you have to use like glue score or other like language similarity measurement.
Yeah. So we basically use the cosine similarity to find the correct match and then compare with the ground truth. That's how we get the F1 score, right?
Okay, got it. Thank you so much. Sorry about the interruption.
Oh, no problem. Yeah, feel free to ask any questions. Yeah. So zero-shot is very useful, right? You can simply plug and play in any new environment. However, zero-shot is not always accurate, right? We know that 0.6 F1 score is like it's like marginal score. So to pursue a higher accuracy but also in a more relatively efficient way, is to simply build a linear classifier on top of the image embedding extracted from the PLIP image encoder. This is so-called linear probing. So basically, is we make the image encoder be frozen and only train the last hidden layer, last linear classifier of the neural network. That linear probing is super fast, right? Because we only train the last layer, and it's also relatively useful to efficiently deploy to others' place. And to evaluate whether PLIP provides better image representation of the training models, we tested on the same 4 external data sets and compare with other fine-tuned linear probing models, including the baseline CLIP and MoodiePath. So just to give a little bit more background, CLIP was pre-trained on 400 million, if I remember correctly, industrial images. And MoodiePath was a method proposed earlier that was trained on around 800,000 pathology images, but their training scheme is different from what we have. So basically, it's also a very good pre-trained model. We compared those 2 baseline models, and we found the results suggest that PLIP achieved state-of-the-art performance in terms of weighted F1 score. And so what we can really do for the future research study if we have the PLIP model on our hand, and instead of efficient fine-tuning with linear probing, if user wish to fine-tune the entire image encoder for best performance, PLIP would be their great choice. So we compared the end-to-end supervised learning algorithm vision transformer in 4 validation data sets, all suggesting PLIP achieved the best performances. And the improvements is especially large when training size is small. So basically, we're no longer freeze the backbone of the image encoder, but we just retrain it end to end. And the vision transformer B32, base 32 is pre-trained on ImageNet. So that's how we compare with our pre-trained on OpenPath with those other models. So for example, if we only use 1% of the lung cancer training data, PLIP can easily achieve 82 F1 score, 0.82 F1 score, compared to 0.65 F1 score for vision transformer with the same architecture. So the conclusion is that with the same amount of the data, when you perform the transfer learning, it's better to use PLIP for pathology tasks as a starting model, which could be very helpful for researchers to conduct their downstream tasks. Any questions so far?
Sorry, another question. What's the task right here? What's the specific task for these two data sets? Is that survival prediction or host line image class level prediction? What's the task?
Yeah, that's a great question. It's not a survival prediction. It's just a binary or multi-class classification task.
So basically you do like multi-instance learning by first cut them into patches and extract your visual representation, use attention-based methods to do the prediction. Because it's a gigapixel, you can't just use as input and get the output.
Exactly. So I think multiple instance learning is other research groups are working on. We're now just focusing on image patches already extracted from the host line image. So it's already like 224 by 224 patches, right?
Oh, those so this is patch level prediction. Got it.
Exactly. Yeah. So so how we get a patch level prediction data for cathode column, they already provided the patch level data, patch level image with labels. For other data sets, we have several different pre-processing to curate those data sets. Yeah. That's a great question.
Thank you so much.
Yeah, that's a great question. So we have demonstrated the usefulness of the PLIP in academic research. Now, I want to present the utility of PLIP model for education and second opinions through the image retrieval. So we will first focus on the text-to-image retrieval. Similar to the Google search, user can input any text, right? And the text encoder will make it become a vector and compare that vector to any other image vector on our candidate pool or on our database. And the highest cosine similarity will give you the best match. So this is extremely useful when we want to recall an interesting case in the database, but we just have our description on our hand. And unlike Google, which performed the text searching, we directly match the text to image, which can potentially allow the best searching experience. So we evaluate the text-to-image retrieval task on the Twitter validation dataset, which dated after November 15, 2022. In addition, we also evaluate in 3 independent datasets, including the Pathpedia website, PubMed collection, and Pathology book collection. So we use the recall at top 10 or recall at top 50 to measure the effectiveness of a retrieval system. It's basically calculate the proportion of target images that were successfully retrieved within the top 10 or top 50 images, right, by the model. So this task can be very challenging because one sentence can potentially map to many images. And many images look the same. For example, if you just search a breast tumor image, then all the images with breast tumor may appear, and that may not be the one you are really looking for. So that is a really challenging task. But nevertheless, we still observe a huge improvement compared to the CLIP model and even the random performance, with an average improvement of around 4-fold and an average improvement of about 15-fold compared to the random retrieval. So now, as what I mentioned, text-to-image retrieval, you can use PLIP to search image in our web demo. And the PLIP is able to comprehend the text described by the user. For example, if the input is breast tumor surrounded by fat, it will return you the closest match. If the input is colorectal cancer tumor on the epithelium, the best match also shows the relevant result. But however,
have you tried going the other way around? Like for pathology assistants, for example, to write the reports, like having the image and then try to describe it?
This is a really great question. And because our talk is about current and future, I want to discuss more on the future side. Yeah, this is a really great question.
Got it.
Um,
Thanks.
but I can mention it a little bit. From text to image, the retrieval is, we have a fixed database, right? For image to get the pathology report, it is really crucial to, do we really have that database of pathology report, or do we just using generative AI to generate the report? Those are questions we want to discuss further. Yeah, but it's a really interesting question. Thank you. But however, the success of text-to-image retrieval may depend on many factors. If the input text associated image are not indexed into the database, then the system may be unable to return the relevant item, right? But however, for me, I'm not a pathologist, but I do feel it is very useful as a non-pathologist researcher. And now, even for me, I prefer to search it here instead of searching on Google. So the last part I want to mention is image-to-image retrieval. This is similar to text-to-image retrieval, but the input now becomes image. The system will compare the input image with all the candidate images indexed in the database, right? Similar to the one we have shown before. And it will return you the one with highest cosine similarity. This is extremely useful when users wish to search similar images for like educational purposes or just seek for second opinion. As we mentioned, this allows user to compare their cases with other classic cases and potentially remove the bias and improve your diagnosis accuracy, potentially. So we evaluate the PLIP image-to-image retrieval task under 3 unique data sets, each with a specific focus, including distinguishing tissue types in column data set and organ types and staining style, such as H&E image, immunohistochemistry images, fluorescent images, so forth. Among all the evaluation, our PLIP model achieved the state-of-the-art retrieval performance, if you can see the top line. Yeah, so now the PLIP model can be used to search similar image. Here we demonstrate 2 examples. In the left example, we input an image that contains mitotic figure. Those mitotic figure like this as an example. For people who may not familiar about the usefulness of distinguishing mitotic figure, typically in a whole slide image, there are up to 1 million to 2 million cells, right? Mitotic figure are typically very, very difficult to find, to locate as well. And it is especially enriched in tumoral region. And the number of mitotic figure appear in tumor region is related to the tumor stage, right? Because tumor cells are progressed more aggressively rather than other normal cell types. So we would often have a higher chance to observe more mitotic figure in a high-grade tumor rather than a low-grade tumor. So it's a really important factor to help us grading the tumor, right? So it's very important. But I don't want to mention too much about the pathology. Here we just simply demonstrate that our search engine can able to find the salient object which is mitotic figure and retrieve the relevant image, which also featuring mitotic figure.
Oh, I just want to second on this is such important work. Like people are trying to do cell type classification for all different kind of cancer, but there's classified epithelial, endothelial, lymphocyte. But not many work have been done on mitotic body because of sparsity and other things.
Exactly.
I just saying like they are able to do this is very cool. And if you're, I'm not sure if you have done this before, but you use your visual representation, you can get the feature importance for all the whole slide images on the TCGA data. They have the survival, they have the tumor grade. Like maybe you can show just by using like number of mitotic body, or you can show your methods can be a mitotic body detector, and in the end, it can be a different kind of diagnosis.
Exactly. So this is actually our ongoing project. Now it's under revision. Hopefully I can have the opportunity to disseminate the latest research in the future. Yeah. Thank you.
Yeah, my comment to that, it goes kind of in the same line, because at the beginning you mentioned that the Ki-67, for example, that is the marker for mitotic activity.
Oh, really?
And as you know, is actually very subjective on how pathologists count this.
Exactly.
Like they just count it kind of like an average out of whatever they feel like on all stains. So you can make a count, like an objective count. Well, to say that that's subjective, that puts them in a difficult position because there are no thresholds. So, for example, there's no really clear threshold on which one is the percentage of mitotic activity that you should observe to treat or not treat. So if you're able to provide them with a more objective count of that and link it to survival outcomes, for example, in the case of cancer, that's a huge improvement in objectivity for the pathology field. Yeah.
Thank you so much. This is a really great point. We are actually thinking about the same way. My other ongoing project right now is try to using the cell level feature to quantitatively provide a better measurements for different staging and also the disease types. So rather than a subjective gut feeling or like ranking, we instead use quantitative approach to separate those different subtypes. Yeah, so that's very interesting. Yeah, so here's another example on the right. The PLIP can retrieve the very similar images as what you input. And now the search engine is also available online. And yeah, feel free to try it. And here's the summary. We show that public data set annotated with natural language from internet is a tremendous resource to advance pathology AI. And the model we propose, the PLIP, can perform various downstream tasks, such as zero-shot learning, linear probing for research, right, for research purpose, and image retrieval for educational and second opinion purpose in clinical workflow. And now you can start using PLIP for research. We provide a easy and handy Google Colab tutorial, and we encourage future researchers easily download the model and fine-tune the model in just few lines. And I have to mention there are other great vision language medical AI coming out this year, earlier this year or later this year. For example, BioMedClip using PubMed images with many radiology images. This is a really interesting work proposed in Microsoft. Also, a model called Xi'an, proposed by University of Washington, is partially based on OpenPath, which is really exciting and interesting. And they also curate a lot of additional data from YouTube videos, which is also really a cool idea. So we're really excited to see people pushing this area forward and really excited to see new medical AI coming out this year, such as Google's MedPalm, right? But however, I also want to mention the current research limitation in our study and in this field. And because there are many questions that needed to be solved by us. First is there's still lack a highly reliable visual language model, foundation model for medical imaging. When I mention the highly reliable vision foundation, I really want to compare it with for example, GPT 3.5 or GPT-4. Comparing to the progress in natural language processing, image processing is a little bit lag behind the natural language process. We have to accept the fact. But I'm sure in the future, we will have a much more robust visual foundation model that can be very useful for us to advance the medical AI in the future. And second, the issue of hallucination will greatly undermine the trust between the human and AI, which will lead to the algorithm aversion. So human tends to trust the AI if the AI can provide accurate answer and also can justify the answer. If the AI is super accurate, like say 99% of the time, the AI is giving you better and correct answer, but only 1% of the time, it hallucinates. Think about it. A doctor will simply just won't trust the AI anymore. So that's a really important fact when we consider deploying such AI into the real clinical real world setting, especially in the medical, especially in the clinical domain, right? Because we have to be very careful.
I understand with you about that point, but I think that everybody in this call is cognizant of that, that I think that that task is actually on us to convince physicians that even if the model is hallucinating, we still outperforming certain tasks for humans, right? The issue there is to break that barrier between saying, okay, the pathologist also can be wrong, you know. So even if we use their diagnosis as the ground truth, they're not 100% accurate. And actually, one of your first slides showed that, and I was going to ask how do you deal with that uncertainty? That it said it was something along the lines that these are the characteristics of the cells, highly suggestive of, and then the diagnosis. But it's not a definitive thing, which is a thing that pathologists do a lot, right? So I guess one is my comment, and the other one is how do you deal with that uncertainty on the images in the natural language?
So it's a really thank you. It's a really interesting comment. And that prompted me to think more about the psychology effect between the human and AI. And I think it's really interesting to study further about how well they can collaborate. Did I answer your question?
But I guess in your model, in your input for the natural language side, how do you deal with the uncertainty that is inherent to the natural language?
Exactly. So we have to accept the fact the input is not always 100% accurate, right? So the data could be very noisy. And what we can do on our side is try to use a more stringent inclusion-exclusion criteria to clean the text, to make sure the texts are high quality. But we cannot guarantee all the text descriptions are 100% accurate. So so this is also one of the limitations.
Yeah,
that's true. Sir, the last thing I want to mention is, in my personal opinion, I think medical images are quite fundamentally different from general visual images, right? I always use an example to demonstrate it. An adult can learn how to drive a car in just 17 hours. A med student, but still needs to learn 8 years to become a clinician. And we're still not fully solving the autonomous driving. And so I believe medical AI is still a way to go. But we're really excited to see everyone is pushing forward on this effort. So but just want to mention it's a quite different task than general visual images. And it's also very challenging. So since the April, the model has been used over 60,000 times. So we're really excited to see other people start using the model and evaluating the model. So I would like to thank my collaborators and advisors. Federico is the co-first author in this paper. He is truly a genius and genius computer scientist. Mert is a fantastic and talented researcher. And I would also like to thank my advisors. Tom is the chair of pathology department at Stanford. James is our PI leading this project. Without their guidance, we wouldn't be able to achieve this success. So thank you. Oh, one more thing. So in the universe of data-centric foundation AI, we will release the OpenPath V2 in the coming months. This is going to be the largest pathology image text and VQA dataset like never before. Along with that is our brand new AI system towards a more reliable pathology AI copilot. And the aim is not only solving the image to text problem, it's also try to, like what we have discussed, text to image to text problem. So basically we have an image and to see how AI can generate a text report. So stay tuned and please subscribe my Twitter or X account for updates. Thank you. Feel free to ask any questions.
Thanks a lot, Zhi. That's great work.
Thank you.
Anyone else has any questions?
I had a couple of questions. Thank you so much. This is very inspiring, although not my domain at all. I was just trying to like brainstorm things I would love to see and kind of like take it as an opportunity to discuss like what would be, most useful. I was wondering whether you had considered, I see this image, like what kind of treatments have been made and, asking questions of the sort like pre-post, like, okay, this is like how the tumor looked like, prior to any treatment. And then someone says, okay, like what if I were to do this, apply this, treatment on that image, what kind of transformation would that yield? And even asking questions like, like I have this patient with that image, and then I'm thinking about like as a user, as a physician saying, okay, I'm thinking about these 3 treatments. Like tell me based on prior images of pre-post, like which treatment is the most likely, potentially combining actually your pathology slice with a set of patient characteristics, like you were saying earlier, age of the patient, biological sex, etc.
Yeah, this is a really great question. So we also have a similar finding beyond this study. For this work, we are more focusing on image-based diagnosis, just try to distinguish tissue types, right? But in reality, on Twitter, when we did a statistic, we found only 65% of the time clinicians really ask questions within the image, ask the questions on the image. And the rest of 35% of the questions are actually asking the question beyond the image. For example, given the image, we already know it's very easy to diagnose, but what is the next step you want to do? What's the 5 years prognosis, like survival rate? How would you guess the clinical etiology or the history of the patient? So like 35% of the questions on Twitter, on the public forum, are actually not really worry about the image diagnosis, but rather than further implication of the image. So yeah. So I think, in my personal opinion, senior pathologists would be more interested in that question more. So that's very interesting.
An extra comment about this. I work in cancer in brain tumors, and I'm recently involved with a pathologist actually, but looking more at the molecular features of tumors. So I think that an important part of kind of piggybacking a little bit on what Marie said, it's important also to know the more objective. I'm really torn by how diagnoses are very subjective. So that's why I mentioned a lot of subjectivity and objectivity and the molecular features that you're finding on each one of your images, right? I know that this comes from Twitter, that information may not be available, but in other repositories like TCGA, you might have other molecular features that can augment not just the diagnosis, but inform treatment.
I see. I think this is a great question. I think pathology images, they have different staining types, right? H&E and immunohistochemistry. On H&E, there are some of the molecular features can be observed, such as the microsatellite instability. Some people are working on that field. I think molecular feature would be extremely more helpful in immunohistochemistry image. When you have a IHC image and you tell what is the antibody they use to stain the image, and based on the antibody they use, based on the clinical history and based on the staining result, we could influence the future of the image, right? That's something can be very helpful for IHC, I think.
Sorry.
Oh no.
Oh, I'm very curious. I hope this is an okay question to ask. For the OpenPath version 2, are you using the image from like you get from Twitter and you fine tune or freeze their question answer into generating the vision, question answering data set, or is actually data set from Stanford?
It's a great question.
I don't know if I'm allowed to ask, but
part of it is a trade secret. No, just kidding. So yeah, so part of the VQA questions are from the Twitter. But we also try to use GPT actually to help us generate the VQA from a text description. But
got it.
our current understanding is the quality is actually not really good. And high quality data is very important. And we're now leaning to not using that GPT generated questions. Yeah.
Got it. So it's images data based on Twitter, and you're trying to ask pathologists and maybe with some help from GPT to generating questions, answering.
Exactly. Yeah. So that's
Got
the option we tried, but we're now trying to move that forward because of
Thank you.
quality.
Yeah. Thanks.
Mm-hmm.
Also great work.
Yeah, thank you.
I just wanted to ask two more questions, like one related to what you said about how like pathology is so specific and sensitivity to like perturbations. I was wondering about the value of combining, in a single repository for text to image or, image to image, or actually image to text retrieval, pathology images with like radiology, with, like brain images, like Eduardo was asking, like chest x-rays, I don't know, very much like biomedical knowledge graphs, how we can overlay different types of graphs, right? Different types of interactions. Do you believe it could be valuable? Like, is it the case that sometimes physicians are searching for something and they may actually order, I don't know, a chest x-ray, a scanner, and an MRI, like, 3 different things. Is it common to have like these different types of images? That's one question. And another aspect I was interested in, I know in your group, you try to quantify like value of information, value of clinical information quite a bit. And do you think there could be a system where you map out the current network of people who contribute data on medical Twitter or something else, and you also know which queries people have made that yielded like 0 response, like someone is super interested in something, but there's not yet data for that. And suddenly you have this user who contributes, an image that would actually map to this prior query. Do you think there could be some sort of like incentive system for people to contribute original images? Like, how do you quantify like the value of a new image if you have this like continuous system that you keep running, and yeah, you keep like onboarding, let's say, new images?
Yeah. So those are 2 great questions. I will first answer the second question. I think that could be a very interesting future research path, right? Road path. For example, most of the Twitter questions are really more higher level or more advanced, because that's something clinicians are not sure about. And that's the reason why they seek for additional help on the public forum. Otherwise, if it's a relatively simple question, they might just ask their colleagues. So we do realize some of the questions from Twitter are quite challenging. Yeah. Speaking about the first questions you mentioned, I totally agree. So I think previously Google proposed, by the time Google proposed MedPalm, they mentioned they had a sentence saying medicine by its nature is multimodal. So it's actually quite true. Just take an example in pathology department. When the pathologist make a diagnosis on the tumor stage or on some like checking the tumor stage or the progression of the tumor, if they are not quite sure about it, they might ask an additional IHC staining. And when they perform the diagnosis, they not only based on the image they are looking at, they also look into the clinical history, the patient history and clinical report and molecular like testing results, such as microsatellite testing. And sometimes when they want to make a diagnosis and make a they not only look into the primary tumor, but also possibly look into the adjacent lymph node to see if there are any adjacent metastases into the lymph node. If a clinician observes more metastases in lymph nodes, then the chemotherapy, then it really changed the dosage of the chemotherapy, the treatment plan. So really, it's when they perform the diagnosis, it's really multimodal. So yeah, so in the future, it's really an interesting topic to combine all those different sources of data to make a holistic diagnosis.
Yeah, thank you so much. That was pretty interesting.
Thank you.
Okay. Thanks so much, Zhi. That was amazing. Hopefully you can visit us in Berkeley at some point where you can have a much longer discussion on pathology.
Wow, it will be my honor. Yeah.
Thanks. Thank you, everyone.
Yeah, thanks for